The U.S. Army Corps of Engineers has been working on an initiative called Engineering with Nature. It all started in 2010. And this is the EWN Podcast. EWN is developing and implementing nature-based solutions for water and infrastructure projects. It's bringing together a growing international community of scientists, engineers, and researchers from all kinds of disciplines that are committed to harnessing the power of nature to solve problems. The EWN Podcast tells their stories. Now here's your host, Sarah Thorne of Decision Partners.
After another summer of sweltering heat, extreme flooding, and in several places, unprecedented forest fires, we're thinking a lot more about climate change, and we're thinking a lot more about the nexus of climate change and health. Today, experts project that between 3.3 and 3.6 billion people are already vulnerable to the impacts of climate change. Our guest is using what he calls his superpowers to assess how climate change is affecting people's health around the world and take action. He's passionate about making a difference in his community and across the planet. Welcome to Season 8, Episode 1. Jeff King, lead of the Engineering with Nature program, and I are just delighted to be kicking off Season 8 with our very special guest, Dr. Christopher Lemon. Jeff, you recently met Chris at a conference, and frankly, you were blown away. I think you were still at the conference when you sent me a note to say, we have to have Chris on the podcast. So over to you, Jeff. Please introduce Chris.
Well, I'm delighted to. It's great to be kicking off Season 8 and just absolutely thrilled to have Chris with us today. I met Chris this summer at a Department of Defense, U.S. Fish and Wildlife Service joint conference. Chris is a medical doctor and a Bloomberg Fellow. He joined the Johns Hopkins Department of Emergency Medicine as an assistant professor in late 2021. And as you'll hear, his nonlinear journey, that's right, a nonlinear journey, has led to his interest and focus on the intersection of climate change and health. And this is certainly a topic that is near and dear to my heart. So welcome to the podcast, Chris. We are really looking forward to this conversation.
I've been looking forward to this too. Thank you so much for having me. I can't tell you enough how sort of inspirational that was for me to be at that DoD convening, because that's not a place you would normally expect to find a physician. But certainly it was very rewarding, and I met some amazing people that will hopefully turn into career-long friendships just like this one.
Well, exactly, Chris. And I got to tell you, you inspired so many people during that conference. We were all just abuzz about what you had shared in your presentation, just the way you integrated all of those really interesting images and how you created so much optimism in terms of potential outcomes that didn't necessarily have to take us down the road of no return or a point of no return. So just thrilled that you can come onto our podcast and share your message with our listeners.
Oh, yeah. I mean, that was an opportunity of a lifetime for me to get in front of a group with that level of expertise in a sector that's not the same as my own. I think that when you have those intersections of expertise, the magic really starts to happen. And I fully admit, as I was walking around the convening that week, at first, day one, people are looking at my name tag and they're like, oh, you must be with Air Force or Fish, or no, I'm a doctor. And it's kind of like, am I here for support if somebody goes down or something? And then, pretty quickly, though, I think, Jeff, I was sitting with you in one of the working groups and started to pick up on, have we thought about, the mental health implications or physical health implications of some of these engineering projects that you're talking about with nature and military installations. And pretty quickly, it just became this great synergy of how I bring certain things to the table, but certainly that's the whole point here is I only bring a piece of the sliver of these complex solutions that we need to engineer. And so, again, happy to have this conversation and excited to be a part of the group.
I have been so eager to talk to people in the medical field about the importance of nature and how we can leverage all of those wonderful attributes associated with nature and our surroundings to create more opportunities for improved health and well-being. And that was really a message that struck home for me, having listened to your presentation, and then certainly thinking about the warfighter and these military installations and the wonderful opportunity across 25 million acres of land to do something positive that the employees at the installations, the military personnel, and also the communities that are adjacent to military installations, how they too can benefit from this interaction with nature.
I think that's a pretty good setup for our conversation today. Thanks, Jeff. And Chris, you know, before we dive into the many, many challenges of climate change and health, I think it would be really interesting to hear a little bit about your background. It's always something that's really interesting to Jeff and I. Your story is so inspiring. And as Jeff said, it's very nonlinear. So share a little bit about your journey, starting with what led you to become a clinical physician and, in fact, an emergency doctor.
Sure. So I'll take you back to the beginning. I think
okay.
Conveniently, setting up this story, as Jeff was mentioning, the National Conservation Training Center is where things all kind of started for me. Ironically, that's bookended at the early days of my life. My dad was the first director there. He's the one who sort of envisioned this. And it's funny because, as a kid, you watch your parents and you see what they do, and I don't think you necessarily really understand it until later on when you carve your own path. But in talking to him since then, he's since retired, he describes how the Fish and Wildlife Service's mission is working with others to conserve nature and natural resources for the benefit of the American people. And I think that's the important part, is the working with others there. Mm-hmm. He really envisioned this as a place to draw together expertise in conservation and management of natural resources together. How do we learn together? How do we bring together different groups with different viewpoints, be them traditionally environmental groups or private equity or environmental organizations that traditionally may not have gotten along so well, and use this training center not just in the classroom but at dinner or in the gym to prevent vilification, to get to know these other people. They're human beings. And I we'll come back to that in terms of identifying commonality between us. And that's really important as we try to overcome these issues. So sure, now as a 39-year-old, I understand that. But as a 6-year-old wandering around the place, I don't know that I fully appreciated that. But that's just been what's so great. I grew up in nature. That was a big deal. Last Child in the Woods was published when I was about to go into college. And that was fundamental for me. And I decided going into college that I thought that I was going to do environmental studies, and ended up pivoting pretty hard there.
Well, and that's an interesting story. You were telling me a little bit about that when we were preparing. You were on an environmental track, and then something major changed. Tell us about that, Chris.
Sure. So you know how it is in college when you start to look into student interest groups, and there was a trip that was going to Ghana, and I was like, sure, why not? This is a medical trip. And we went over, and then we were literally packaging baggies of like Motrin and Tylenol and basic blood pressure medications, which that's important. But we show up, we say we're here to help. We hand out these baggies of medications that'll run out in a couple of weeks, and we leave. And again, that's not a knock on the people trying to do good work, but it just felt so incomplete. There's such a much more complex issue here. And so I ended up going the opposite direction. I was going nuts trying to stay in chem lab during pre-med training, as I thought maybe healthcare. So I actually joined up with a few other students, and we found this amazing vice provost in background in sociology. But his experience, his origin story was he was military intelligence in Vietnam and would embed in these communities in Vietnam. I mean, you talk about trust building in a community. He would be hidden under somebody's house for 5 days while the enemy forces moved through, and ended up using that to create a whole career in community-based participatory research. And so we realized, why aren't we doing a medical clinic as a trust-building exercise that then leads to the real root of the problems? How do we work with communities and share that research together to find out what are the environmental determinants of health that are impacting them and how can we affect bigger change? And so you can see pretty quickly I'm on this nonlinear track, right, veering left and right here. But it just became very obvious to me that there was this potential here that many people have realized, that there are multiple ways to be involved in bigger solutions from a healthcare vantage point.
Well, Chris, that is an incredible story, and certainly starting to see that big light bulb and how this was transformative for you. And so maybe you could tell us a little bit about how you moved from, say, environmental studies to becoming an emergency physician.
Sure. So the quick version of that is that, go figure, there's a lot of track-based learning in healthcare right now. So you focus and you get into medical school, and then you do medical school to get into residency. And then with residency, sometimes you go on to fellowship. And I definitely had the experience too, where you get spit out the other end and you're like, oh, I'm supposed to have arrived now. What comes next? Can somebody help me here? I ended up doing emergency medicine and pediatrics as a combined program. So boarding in both of those, because I thought it was the biggest macro breadth of experience I could bring to these ideas. And what I found out was it's actually pretty difficult to stay in academics if you're working as a part-time faculty in two different departments. And I'm actually sort of glad for all of these sort of missteps, because I went into the community and that was great. You know, it's one thing to be in an academic situation with certain resources available to you, talking about what we need to do. It's another thing to actually be on the ground in the community, right, working with neighbors, right, figuring out what their perspectives are. And so I worked in a community emergency department. A couple of other hiccups. My group got bought out by a corporate equity group. The dynamic changed. I felt like I lost a certain degree of control. And it's not to vilify them. You know, business is business to some extent, but it just wasn't for me. I pivoted and went back to working with a small, what we call solo democratic group, where those of us in healthcare that sort of own the practice ourselves and have full control. What we found out was when I started that job, a few months in, it was the height of COVID, March of 2020. And so being in a small group also presented a bunch of challenges if you were to view us more as a, quote, mom and pop type setup, when you have to overcome all these challenges during the pandemic. And so, you know, the bumps and bruises along the way, I think what I came out the other end with, and what we'll end up talking more about, is, you know, these were all learning experiences, but it just kept making me think about the complexity of problems that we have and what's the best way I can help.
Chris, I want to talk a little bit about your COVID experience. We touched on it briefly when we were preparing for this show, and I know it had a profound effect on you as a frontline physician, but it was also really transformative in terms of your life's work. So share a little bit about your experience in COVID.
Oh, sure. I mean, that certainly, I think for many of us was a fairly dark time. And I don't mean just in medicine, you know, everybody felt vulnerable.
Absolutely.
For us in healthcare, I mean, that's something that we're not always used to. I mean, in emergency medicine, occasionally you have a combative patient who might try to take a swing at you, but you don't have this existential threat of a pandemic that you're literally staring right in the face a foot away every day, all day long, as you're working to do things. And then, you know, compound that with, at least in our family, the reality at first, we have little kids. You know, can I hug my kids? My partner, Susanna, is also a frontline healthcare worker. So what do you do when you have small kids and two parents who are up against COVID every day? We pushed away the rest of our family because we didn't want to get them sick. You know, this started to create a bunch of internal stressors for how can I function and cope under the weight of a significant stress. And I think, again, you're going to see these little threads untying to the climate change situation in terms of operating under immense stress. I will also say, from a patient standpoint, as a healthcare provider, you're often there for people, holding their hand at the best times, at the worst times. And those stories are so impactful in terms of how it changes the way you think about the world. And so, you know, I can sit here and tell you that over 1 million Americans died during the COVID pandemic. I mean, I believe those are the figures that we ended up with. But if I tell you about the time that I had a relatively young father call his son to say goodbye, literally before intubating him. That's chokes me up a little bit here too, just because, these are things you carry with you. And so the question as we get into more of the optimism is, how do you use this to motivate? And so that for me was a big push for drawing together this sense of redefining control in career, feeling like I'm actually able to align purpose and vision, and then how to actually take the stories of these individuals that can't tell them themselves, be it because they're gone from COVID or other issues that I'm seeing in the emergency department every day. Again, getting to know your community. How do I bring those forward in a way that's going to help everyone collectively use these tools that I can provide and that the healthcare sector can provide?
So, Chris, your COVID experience really led you to some deep reflection about the state of health in your community, Baltimore, and more broadly, the global community. Talk to us a bit about that.
So, what I was alluding to is this idea that I was picking up on, and clearly not alone, picking up on this concept that COVID felt like a dress rehearsal for what climate change is going to do to society. And for those of us in healthcare, I mean, we're still recovering in healthcare in terms of the number of people that have left or moved on or changed careers, because that was a big burnout for a lot of us to be under that pressure for several years. And so as we start to think about, connecting these dots, there's a great political cartoon I'm sure you can find online where it has the Earth kind of doing a boxing match with COVID and then kind of pulling on the ropes, waiting to get in the ring is this giant thing that says climate change. And that's the thing is, what did we see during COVID? We saw that initially everybody came together and was supportive of the healthcare sector. And then we saw that as time and stress continued to erode things, misinformation, disinformation, a breakdown in trust of healthcare voices. And I just kept thinking to myself, as climate change worsens, we're going to see, what are we seeing right now? Heat causing renal failure and increased strokes. We're going to see worsening air pollution and forest fires, impacting little kids with asthma all the way to women who are pregnant. What does that do to a baby in utero when mom's breathing in unhealthy air? I got a health alert in DC for malaria. Plasmodium falciparum was in the area because of how the climate is changing recently. And I was in Salt Lake for a conference for Clean Med, for healthcare sustainability. And we're breathing in dust blowing off the Salt Lake. And that's now being discussed as potentially having like heavy metals in it. So all of these things are going to impact healthcare, whether we like to appreciate that or not. It's going to become a bigger issue. My bigger concern started to be, what is the construct of what this is going to do to the healthcare system? And our ability to do what we did during COVID is, can we keep up? Can we care for the people we promised that we were going to be there for?
Yeah, Chris, wow. You really do offer so much more context in terms of what is happening out there and why it matters, and the connection that you just offered with respect to human health. I know our listeners are going to really appreciate that, and probably they haven't thought about it to that degree. And so, Chris, sort of building upon this, when you spoke at our conference this past summer, you said one of the key learnings from COVID-19 and that experience was that we're not about nature. We are still part of it. And that really resonates for me on a number of levels. And I was hoping you could talk a little bit about that and sort of where are you coming from when you make that kind of statement?
By all means, I'm not a historian, but just kind of looking back for what's humanity been up to? When you look back across the entire existence of our species, what a tiny sliver of time that we're in right now in the past couple of 100 years, where it feels like, at least in Western culture, we're trying to be somehow above nature or control or tame nature. And I hate to say that from the perspective of healthcare, we're kind of doing it. The things that I'm seeing in healthcare right now, especially at Johns Hopkins, what we can do for people in terms of identifying concerning proteins as blood markers or curing types of cancers by weaponizing our own immune systems against them. It's amazing the power that we have to do this. but there's still this mantra of first do no harm. That's been around for a long time, much longer than just our more recent industrial revolution and the use of fossil fuels. And right now, U.S. healthcare contributes roughly 8.5% of U.S. emissions. So to be doing no harm with the goal of making people healthy, and yet ironically, because we're not working within the constructs of nature anymore, we're actually making people unhealthy. We're working contradictory to our mission. The mission of healthcare is so important and fundamental, but if we're not working within the context of nature, there's no way we're going to be successful. And everybody talks about, quote, the polar bears, right? You know, what's going on with the polar bears? And we've been doing our thing in healthcare, ignoring the polar bears. I think COVID-19 was our polar bear moment. You know, we're the polar bears now. The ice is getting thin, it's melting. And we just need to look at our own health to realize that these impacts are hitting us now, and they're going to continue to hit us even harder.
Yeah, great example.
And that understanding, that crisis really is what led you to your current role at Johns Hopkins.
That's correct. I just realized that we were talking a moment ago about sense of control and sense of impact. And so for me, and I'm sure many people, not just in the healthcare sector, some people may be feeling like they're just a cog in the big machine of things and that they don't have much control over what they can do. They're worried about this problem, but how do they engage it? And then the other hand of it is you may unfortunately be in a situation where you're kind of the solo gun in the equation here. You're sort of working on your own from a very small platform, and you don't feel empowered to be able to do something because you're just trying to survive or, again, put food on the table for your family. This is something we encounter a lot in Baltimore is how can I tell some of our inner city families to care about climate and do something when they're just trying to survive? Yeah. And so for me, putting these pieces together based on all these missteps became this, where can I go to find a way to connect my drive, the vision, the power that healthcare has, and yet at the same time have a platform to engage these in a way where we can make connections to other sectors. And again, that's exactly how I came across you all, is that the opportunities that I found at Hopkins have just fit that. It was right time, right place, perfect moment.
Talk a little bit briefly about your role at Johns Hopkins and what you're doing there.
Sure. So at Johns Hopkins, we have started this Institute for Planetary Health. And essentially the idea there, to briefly touch on planetary health, is that we're taking a more macro approach to climate change. Climate change is an existential threat, but planetary health is basically a transdisciplinary field. It's solutions-oriented, and it's also a social movement, but it's focusing on analyzing and addressing the impacts of human disruptions on Earth's natural systems, but importantly, those disruptions have impacts on human health and all life on Earth. We are bringing that into the center of this, is that our well-being, health, as well as all of the other living creatures on Earth needs to be central to the focus of how we understand these impacts that we're creating. And so I am fortunate enough to be helping to lead up our clinical programs section, representing the healthcare voice with very, very other talented people, well beyond me in many ways, but that's my section. And I've had the joy of being able to work with other people like aerospace engineers and UN policy lawyers. That's the idea, is how do we bring together, just like NCTC, all this expertise and different thoughts into one room so that we can start to talk about affecting real change.
We love that. Jeff and I love anybody that talks about systems thinking. It makes sense. We've all gotten so deep in our little spheres of expertise that unless we bring it all together and talk to each other, we can't affect change. So it's so exciting, Chris. We sure want to hear more about it.
I would love to tell you more. Every day I feel like I meet somebody new in this community of planetary health, and by connections to you all and where it's taking me, I will really say it does give a profound sense of hope when you realize how many people in the world actually do care about these issues and are trying to find their piece in how they're going to fix this or solve this puzzle. Right. It's heartwarming.
Well, and Chris, one thing that really does resonate for me is the energy and enthusiasm in which you approach this. And it's quite evident that you have so much knowledge to share, as well as the energy to provide, to make change a reality. And just having you interacting with others across all organizational sectors, with different disciplines being brought to bear on these challenges, I just know that it's yet another piece of the puzzle that is going to really work and make a difference.
I appreciate you saying that, Jeff. I humbly say I am not an expert. I'm an emergency doc. We are the jack of all trades, masters of none. We know how to get people to help us do things for situations that we can't fix ourselves and beg and plead to get the job done. And yeah, this is why, in some ways I appreciate you saying that. I am simply communicating all of the amazing ideas and expertise of the community that I'm in. And that's my superpower here, right? Is to channel that, is not to be quote unquote the expert, but to bring awareness to the things that other people are doing.
Yeah, exactly right. And Chris, I feel like we've only scratched the surface on the story that we can tell. And so I'm thinking that we should ask you back to do another episode with us to talk more about all that's being done to address the many challenges of climate change and health. What do you think, Sarah?
I think so. I think if Chris would join us for another episode, we want to dig into this discipline called Planetary Health. We want to hear about the Planetary Health Network and all the stuff you're working on, Chris. And we can't do it all in one show.
Give me about an hour nap and a double espresso, and I'm your guy. I'm ready to go.
There it is. Fantastic.
This has been great. Thank you so much, y'all. I really appreciate this.
Oh, well, we look forward to another conversation for sure.
Wow, I certainly do. And Jeff, I know you do too. I think that's a wrap for season 8, episode 1. And Chris, you've sure got us thinking. What a way to kick off their season 8. We want to thank you for sharing your journey this far and this deep passion you have for really making a difference. And we really want to explore with you more about this emerging field of planetary health. So Jeff and I can't wait to continue our conversation with you in episode 2 and learn about how you're channeling those superpowers to really make a difference.
I will do my best to keep on thriving with them, but at the same time, I am just so humbled to be a part of this, and I appreciate the work you're doing.
And to all of you, thank you so much for listening. We sure hope you've enjoyed this podcast. And we hope you'll join us again as we talk about engineering with nature.
You've been listening to the EWN podcast, developed by Sarah Thorne and Jeff King, National Lead, Engineering with Nature Initiative, U.S. Army Corps of Engineers. Now, for more information, you can visit our website, engineeringwithnature.org. The EWN podcast is produced by iContact Productions for the Engineering with Nature program within the U.S. Army Corps of Engineers. I'm Dave Trafford.